rabies. The last case of human rabies in Malaysia was reported in the year of 1998 in Kedah, involving a person scratched by a cat infected with rabies. Sarawak was rabies-free until the declaration of human rabies outbreak on the 1st July 2017. Sarawak Health Department has since reported 6 laboratory-confirmed human rabies cases, 5 of which had died due to the disease. The latest human rabies case was notified on the 8th August 2017. The patient is currently critically ill and warded in the intensive care units of Sarawak General Hospital. Up to 25th October this year, 4 divisions in Sarawak are affected by the rabies outbreak, namely Syrian, Kuching, Sri Aman, and Samarahan. A total of 4,320 cases of animal bites from the outbreak areas have been reported to Sarawak Health Department. Out of this number, 1,586 cases have received vaccination. My ministry is working closely with Sarawak Health Department, Department of Veterinary Services Sarawak, Sarawak State agencies, and non-government organizations in controlling and preventing rabies outbreaks. Rabies is a fatal disease if left untreated. However, it is 100% preventable through prompt medical care. Dog remains as the main global source of rabies disease in humans. To date, 90,000 brochures have been distributed to the community and 420 banners have been put out at strategic locations to educate and continually remind the public on rabies. Sarawak can only be declared free of rabies once again after the Sarawak remains free of animal and human rabies for a period of at least 2 years from the last reported case. For information, World Health Organization has target of eliminating rabies globally by the year 2013. Community Sihat Pembinaan Negara (COSPEN). Datuk Speaker, the Ministry of Health introduced Community Sihat Pembinaan Negara (COSPEN) in 2013 with the objective to promote healthy lifestyle, to provide health screening services, to detect early non-communicable disease among the community members. It is alarming to note that the rate of undiagnosed diabetes is increasing, with 16% recorded in 2014, 16.5% in 2015, and 21.2% in 2016. Since 2013, a total of 989 COSPEN localities have been set up throughout the state, with 5,978 community health volunteers known as Gerak Sihat Malaysia recruited and trained. To date, a total of 40,209 persons has been screened by the Gerak Sihat Malaysia. As at 30th September 2017, the department had registered 126,892 cases of diabetes throughout the state, of which 7,036 cases are newly diagnosed cases. Dengue. As at 21st October this year, 818 dengue cases were reported in Sarawak, compared to 2,302 cases over the same period in 2016, a decrease by 64.46%. Sarawak Health Department is committed to continue to work hand in hand with other non-health agencies in the state to further reduce dengue cases in Sarawak. Datuk Speakers, tuberculosis or TB. As of October 2017, a total of 2,197 tuberculosis cases were reported, compared to 2,242 cases in 2016, a decrease of 2%. Sarawak Health Department is taking steps to detect as many cases as possible through systematic screening and to start early treatment in order to control the spread of the disease. In 2016, the department started a new TB screening service through its mobile X-ray unit. As at 21st October 2017, a total of 7,982 persons have been screened using the mobile X-ray unit at 152 rural locations throughout the state. Out of that, 49 cases were found to have tuberculosis. Rural Health Service under State Rural Transformation Initiative. Rural Health Service is under the Key Result Areas 2 (KRA2) of the State Rural Transformation Initiative. the state government has allocated 2.48 million ringgit in 2017 to finance upgrading of rural clinics projects through the National Blue Ocean Strategy and BOSS approach, rural clinic visiting doctors, and cluster clinic system. A total of 114 rural clinics in Sarawak do not have resident doctor. The rural clinic visiting doctor service is an approach taken to fill this gap before permanent doctors can be posted there. For the first phase in 2017, 85 out of 114 rural clinics were involved in this program. To date, 67 clinics are visited every month, 15 clinics are visited once every 2 months, and 3 clinics are visited once every 3 months. The remaining 29 clinics will be included into this program in phase 2 in 2018. Development projects. For the information of Ali Yang Berhormat, 2 hospital projects in Sarawak are being built under the supervision of Jabatan Kerja Raya Malaysia in Kuala Lumpur. They are Putrajaya Hospital and Sri Aman Hospital. As at 22nd October 2017, the actual progress of Putrajaya Hospital is 27.68% compared with the scheduled progress of 100%. The initial completion date was November 2016. The contractors was granted an extension of time EOT, and the completion date was therefore shifted to 9 June 2017. However, the project still suffered a huge delay. Currently, JKR Malaysia in Kuala Lumpur is closely monitoring the project in order to ensure that this much-needed hospital completed for the benefit of people in Kuching as soon as possible. For Sri Aman Hospital, the actual physical progress as at 28 October 2017 is 23.4% compared with the scheduled progress of 41%. The initial completion date was 25 October 2018. With the approval of the first extension of time EOT by JKR Malaysia in Kuala Lumpur, the new date of completion is now shifted to 3 August 2019. Pharmaceutical services. For the information of Ali Yang Berhormat, Sarawak Health Department has taken steps to further improve the system at medication dispensing counters. 9 centralized collection centers for follow-up medications has been set up at Klinik 1 Malaysia at UTC Kuching, at Klinik 1 Malaysia UTC Sibu, Klinik 1 Malaysia UTC Miri, Klinik 1 Malaysia Taman Maliha Kuching, Klinik 1 Malaysia Taman Rizal Sibu, Klinik 1 Malaysia Fali Sibu, Klinik 1 Malaysia Bandung Sibu, Klinik 1 Malaysia Taman Tunku Miri, and Sarawak Health Department. Other medication collection points such as Locker for You have been set up in Sibu Hospital and Klinik 1 Malaysia Taman Tunku Miri. Walk-through pharmacy in Kota Sentosa Health Clinic also has been set up for the patient to ease the congestion at dispensing counters, while at the same time provide alternative collection points for follow-up medications. Follow-up medication can also be delivered directly to patients through post laju to avoid hassles of coming back to pharmacy. For patients who prefer to collect the follow-up medications at pharmacy counters, all hospital and health clinics pharmacies are providing appointment dispensing service where the follow-up medications will be prepared before collections.